do a minimal lip augmentation of this patient who is here for another procedure. She's sedated, as you can see, which is a nice thing with lip injections. The rest of the face really isn't as sensitive as the lips, and so to be sedated is something we offer in our office. This woman does not like those vertical creases and vertical lines. Also, she's lost some definition of the border of the lip between the pink and the white, which is the mucosa in the skin. This is called the vermilion border. When we're younger, there's actually slightly raised, there's a roll there. And it also has lost definition of the philtral columns, the two lines that go up to the nose. And as we age, the lips get thinner and they get longer. And if you open a little bit, also you don't see as much tooth structure. I would bet if we looked at pictures when she was younger that she would show a little bit of tooth like that. So there are several things we can do. One is to just define the lip, and that's what we're going to talk about, and we're going to talk to her about what we're going to do today. So we will be outlining this lip. I like to start at the corner of the Cupid's bow. Again, the Cupid's bow, it's like a bow and arrow. It comes up here, it goes down in the center, and then back this way. So this is the Cupid's bow that you heard about. So I like to pinch the mucosa in the skin just so I can get the definition. And I inject pretty superficially just below the dermis, and then I inject on when I pull out. Some people inject on the way in. I think it's, for me, my technique is on the way out. I think you have a better feel of the material going in between my fingers, and you can see me actually just molding it and moderating a little bit. And it's going to be relatively not noticeable initially, because there's a little bit of puffiness, a little pinch there. Now I'm going at different angles as I recreate the Cupid's bow, so it's a V almost, and off of those points of the V we're going to come up in just a minute, but I want to finish the vermilion border. That's V-E-R-M-I-L-L-I-O-N, vermilion border, and I can just feel the material going between my finger and my thumb. And then also in the corner of the mouth, as we age, the corners tend to turn down. So we need a little bit of extra volume and fullness to try to lift that area. So from a couple different angles will come. So we're now starting to get some definition. It's always possible to get a little bit of bruising. I'm going to go down to the corners, or the commissures is the name of the corner of the mouth, the commissure, and fill that corner. And then we're going to come along the bottom. Open just a little, thanks Larissa, and we're going to just come right along the margin between the pink and the white, same as before. Again, as we get older and the lips get thinner, you start getting some of these vertical creases that go from the skin to the mucosa. And women tell me that when they put their lipstick on over time, that the lipstick can actually bleed or run down these little lines. So by firming this up, that prevents that from happening. It's more of a natural, younger, nicer look. Yeah, thank you, honey. So right along this border here. So I have just a little bit of left. I'm just using one. So I want to recreate with what's left these philtral columns, philtrum. So I inject on the way down, good. Just a little bit of raised area, keep the oxygen going. And I come at an angle like this because that's a little bit deeper than that one, is a little bit more superficial, good. So, and maybe just a touch higher here. Okay, 2 moist sponges, please. So then I got an opportunity to mold these initially. You see a little bit of bruising here, but I want to just feel and mold and smooth out. We have a few minutes here we can actually influence where we place this. So I'm filling the material between my thumb and finger and just kind of evening it out and smoothing it out. And you can see a little bit more definition there. Those lines have kind of faded away a bit. It takes about 10 days to get the full effect from injecting of hyaluronic acid like Juvederm, Restylane, Volbella, Voluma, and essentially all of the HA products, because this material is hydrophilic. It likes water, and so it's the water is absorbed into the material. For the first 10 days, I tell patients it's a little bit more firm. When they wash their face and such, they can kind of feel this little material there. And in young people, if you actually look at, you can feel the ridge. It's more firm, the definition along the vermilion border. We use just one syringe. A lot of times we'll do nasolabial fold, mental creases, other areas, but for this young lady, that's all that she wanted to do. So we're finishing this. In a normal situation, we'd have people put ice. Wherever we inject the fillers, we put ice. Not so much on the Botox or Dysport, but with the fillers. Okay, now we're getting ready to do the rest of the procedure, but I think you're starting to see some definition. There's still a little bruising, some swelling. If I had a little bit more, I'd be doing the vertical creases there, but I just didn't have enough material for this, and that's all we talked to her about.